This is Dr. Phil Perera, and in this video clip I'd like to discuss the pertinent echo findings taken from a patient who presented to the emergency department with acute shortness of breath and hemoptysis. This is a parasternal long axis view of the heart, thus we identify the left atrium as the chamber to the bottom right of the image. We can see the left ventricle, the more muscular chamber, just to the left of the left ventricle, and the mitral valve flipping up and down in between the two chambers. We identify the right ventricle as the most superficial chamber to the top of the image, and right away we can see an abnormality. We notice here there's a communication between the left ventricle and the right ventricle, indeed a patent ventricular septal defect. Notice that color flow Doppler delineates the flow of blood here from left to right, but let's take a look at the relative size of the right ventricle in relation to the LV, and we can see that the right ventricle is becoming more dilated than the left ventricle, ominous for increasing pressure within the pulmonary artery system. Thus, this patient is at high risk for future development of Eisenmenger complex and syndrome, where they'll have reversal of flow through the VSD due to increasing pressure within the pulmonary artery system, leading to shunt from right to left and acute hypoxia and sudden onset of death.